All right, today we're going on a bit of a journey, a radiologic walkthrough of rheumatoid arthritis. We're going to play medical detective and use imaging to see exactly what this disease does inside the human body. It's pretty fascinating stuff.
So just think about this for a second. What if your immune system, the thing that's supposed to be your personal bodyguard, totally got its wires crossed? Instead of fighting off germs, it turns around and declares war on you. That's not a movie plot. That's the reality of rheumatoid arthritis. It's this bizarre mystery where your own defenses start attacking the very joints that let you move.
So let's start our investigation with the absolute basics. What in the world is rheumatoid arthritis?
Okay, so rheumatoid arthritis, or RA for short, is what's called a chronic autoimmune disease. Chronic just means it's long-term, and autoimmune means your own immune system is the attacker. The target? A really specific part of your joints called the synovium. That's the delicate lining that keeps everything moving smoothly. But in RA, the immune system goes after it, causing a ton of inflammation, which, if you don't stop it, just keeps destroying more and more of the joint.
Now that we've identified our culprit, the body's own immune system, let's zoom in and take a look at the crime scene. What actually happens inside a joint when this attack kicks off?
First up, let's establish a baseline. This is a healthy joint. See how nice and smooth that cartilage is at the ends of the bones? And that thin little lining? That's a synovium. It's all working just as it should, letting you bend and move without a second thought. This is our before shot.
And here we go. This is where the attack starts. The immune system basically floods the area with inflammatory cells. That once thin synovium starts to swell up, getting all thick and angry. This isn't your body trying to heal something, it's actively causing damage. The very tissue that's meant to help the joint is now turning into the weapon.
And this swollen tissue is aggressive. It starts pumping out these enzymes that literally eat away at the cartilage and bone. The damage often kicks off in what we call bare areas. These are little spots inside the joint where the bone isn't protected by cartilage. They're vulnerable. And of course, all this destruction just creates more inflammation, which leads to more destruction. It's a truly vicious cycle.
So you might be wondering, how can we possibly see all this chaos happening deep inside someone's body? Well, this is where our radiologists come in. Think of them as the detectives with the high-tech gadgets able to peer inside and gather the evidence of this internal fight.
Here are the main tools in their toolkit. You've got MRI, which is the gold standard. It sees everything, soft tissue, bone, you name it. Then there's ultrasound, which is amazing for spotting active inflammation as it's happening. But you know what? The classic X-ray is still a huge player. It's cheap, it's everywhere, and it is fantastic for seeing the long-term structural damage, the bone erosion, which is a dead giveaway for RA.
Okay, we've got the tools. Now it's time to open the evidence file. Let's look at the specific clues, the telltale signs on these images that make a radiologist say, aha, that looks like rheumatoid arthritis.
And wow, this is where a picture is truly worth 1,000 words. On the left, a healthy hand X-ray. You see those nice clean spaces between the bones? Now look at the right. That's a hand with advanced RA. The spaces are gone. The bones look almost moth-eaten in places. The visual evidence of that internal war is just undeniable.
So when a radiologist looks at an X-ray, they have a checklist. They're looking for swelling in the soft tissue first. Then they look for something called periarticular osteopenia, which is just a fancy way of saying the bone right next to the joint is getting thin. Then they look for that joint space getting smaller and smaller. And the big one, those marginal erosions, where the bone is literally being eaten away. A final, crucial clue, there's no new bone growing. This disease is all about destruction.
And this quote right here is so important. It tells us that when a doctor sees those erosions, especially early on, it's a huge red flag. It's a sign that this is an aggressive case of RA, and they need to hit it hard and fast with treatment to prevent even worse damage down the road.
But you know, a diagnosis isn't just about what you can see. To make sure everyone is on the same page, the medical community created a classification system. And to get that official RA diagnosis, it all comes down to hitting a specific score.
And that magic number? It's 6. According to the official criteria, you need to rack up a score of 6 or more based on a few different categories to be formally classified as having rheumatoid arthritis.
So how do you get to 6? Well, it's a combination of these 4 things. They look at which joints are involved. You get more points for smaller joints in your hands and feet. They do blood tests for specific antibodies. They do other blood tests to measure the general level of inflammation in your body. And finally, they look at how long you've had symptoms.
It's a really thorough system that pieces together all the different clues. Now, any good detective knows you have to rule out other suspects. There are other diseases out there that can cause joint pain and can even look a little bit like RA on an X-ray, so you have to be sure you've got the right culprit. The most common imposter is osteoarthritis, or OA, but there are some key tells. RA loves to attack the joints closer to your palm, your main knuckles. OA, on the other hand, usually goes for the joints closer to your fingertips. But the biggest difference is the cause. RA is that inside job, an autoimmune attack. OA is more about mechanical wear and tear over a lifetime. The who and the where are totally different. And all of this brings us to a really fascinating and hopeful final thought. We've seen how imaging lets us track the destruction, but as our technology gets even better, letting us see the very first whispers of inflammation before any real damage is done, it raises an incredible question. Could we one day get so good at spotting the signs that we can step in and stop this disease cold before the damage even begins? That's the goal. That's the future everyone is working towards.